Thank you, Representative Scott. We're now going to hear about some of that data and that research-based approach to programs from Brent Orrell and Vanessa Marks. So Brent, Vanessa.
Thank you, Fred, and thank you, Congressman Julio. Good to see you. It's a pleasure being with you this morning. My history in this issue reaches back to 2001 when I joined the Department of Labor Center for Faith-Based and Community Initiatives office, and we started looking at what might possibly be done, and people like Julio and Kevin Gay came along, and an effort when we didn't know if there was any money, we didn't know where it was coming from, but we worked together to create what became Ready for Work and the Prisoner Reentry Initiative. So that's kind of a little bit of my background and history on the issue. Currently, I'm working for ICF International, which is a Fairfax, Virginia-based consulting firm. It was founded in the late 1960s, and the initials, ICF, stood at that time for the Inner City Fund, and it was established by a Tuskegee Airman who was interested in promoting economic development in inner city Washington. Since that time, it has grown from a very small consulting operation into an international consulting firm that provides a very wide range of services. Vanessa and I, and Jesse Kendall is here with us from ICF today as well. We're part of a team within ICF called Family Self-Sufficiency. And we're trying to carry on that original vision. You know, how do we promote economic stability for low-income communities and individuals? The Family Self-Sufficiency team within ICF conducts research and drives system and program level improvements in a wide range of federal and state programs, including workforce development, prisoner reentry, TANF, the TANF program, child welfare, you name it, we are likely engaged in that program. So today I just want to briefly frame the study that we conducted and give you a little bit of a history of DOL, ETA, and the Employment and Training Administration, the Youth Office. I see Jen Troke here with us today from the Youth Office, and the work that that ETA has done over the years on this topic. A lot of the statistics that we're going to be looking at, you're going to be well aware of, very familiar with. You know, we've got 12 to 14 million people, and if you stop and just ponder that number for a minute, 12 to 14 million people who have criminal records in the workforce, or they're working age individuals in the United States. That's a lot of people. And yet, an awful lot of these people who have criminal records are not working. I was really interested in what Congressman Scott had to say about employers and the need to work on the problem of the felony boxes on employment forms. It's true. It's a critical issue that needs to be addressed. When we launched our initial efforts on Ready for Work and the Prisoner Reentry Initiative, before we did that, we actually pulled some employers together because we wanted to get them talking a little bit about, like, what is this? You know, why do you use boxes like this? Now, we weren't so foolish as to not understand that there's some pretty clear reasons why an employer would be looking for a reason to screen out people who have criminal records. Our real objective was to figure out what would make a difference to them. How could we lower that level of fear that employers experience when they're considering someone who has a criminal record for employment? And so we started talking to them about relationships with community-based organizations, about mentoring, about strategies for reconnecting people who are coming home from prison to their communities. That's the problem. That's the real problem. You're dealing with people who have been cut off from their families, from their communities, from the whole society because they've been incarcerated, and now all they've got is a criminal record. That's all that anybody can see. And so that's where this DOL, the insight for this DOL program came from, is that we could encourage employers to think more broadly and to encourage them to think about these ex-offenders not as ex-offenders, but as people who had relationships in the communities that they were returning to. So lifetime earnings, as we know, for people with criminal records are about 30% lower than individuals who do not have criminal records. So that's just the starting point. Not only is it harder to get employed, but if you do manage to get employed, you're stepping back in terms of your earning capacity. As we know, we've talked about this extensively. Two-thirds of those two-thirds of returning citizens are rearrested on a new offense within 3 years, and nearly half are reincarcerated. So we've got the revolving door still going on despite some of the progress that has been made. In 2003, as I mentioned, we came up with this idea called Ready for Work. And Fred and his team, Fred Davey and his team at Public-Private Ventures and the Employment and Training Administration came together for the first time to try to pilot an alternative approach, something non-punitive, something that was really focused on reintegration and employment rather than tracking and parole and probation and all of the sort of the criminal justice side. We wanted to try something new. And the core elements of that approach were employment, connections to community-based organizations, and mentoring. And what we found over the years of the implementation of that project was that the program data, this is not evaluated data, this is not, we didn't have a control group, we didn't go through the whole RCT, randomized control trial process for determining effectiveness. But what we saw in the data was that people participating in the program did a lot better. They had about 60% employment retention at 3 months and 50% at 6 months, and they had a much lower incarceration rate. Now, we also found that those participants who were most engaged in the program, those who participated in the mentoring component, did even better. All right, so the more you engaged in that, the higher the likelihood was we found that you were going to avoid reoffending and reincarceration. It also showed a strong correlation between, I'm sorry, that was the mentoring piece. Based on those results, in 2004, if some of you in this audience I know will remember this, when President Bush stood up in the State of the Union address and said, we're going to do a prisoner reentry initiative because everybody deserves a second chance. And Julio Medina was sitting in the box with the First Lady that night and was recognized for his work at Exodus Transitional Community. And it was one of those moments where I think a lot of people were kind of scratching their heads. How is it that this Republican governor from Texas was embracing the cause of improving services to reentering citizens? Since that time, from 2005 to 2015, ETA has awarded nearly $400 million to 19 different cohorts of organizations that are providing services through employment-targeted services for reentering citizens. Jen and her team do a wonderful job of managing this program, and they are so open about trying to figure out what works and then incorporating that. So we've seen some evolution in the program as more information has become available. We've had refinements and improvements to the program. The core elements remain the same. We want strong case management. We want connections to community-based organizations. We want strong case management. We want employment referrals. And we want connections to individuals who can provide supportive services and just personal support to individuals who are coming home from prison. So that's kind of the background on what you're going to hear today, because this is really a look. This study that Vanessa is going to be briefing us on, and Jesse and the rest of our team here today, is really looking at 10 years of data reported by grantees to tell us more about what works. So I'm going to turn that over to Vanessa to brief us on that.
Hi, everyone. Good morning, and thank you so much for coming. My name is Vanessa Marks, and I'm a senior manager with ICF. So I'll talk to you a bit about our methodology, what the approach was for this study. So the goal of this study was to identify promising practices used by the highest performing nonprofits, faith and community-based organizations that have been funded by the Department of Labor, Employment and Training Administration from 2005 to 2015. So we're looking at 10 years worth of funding. And so what we did in order to identify those organizations was to take kind of a phased approach with the data. And so we first we identified which performance metrics were the most important that we wanted to focus on. And you can see them identified here. The metrics were a little different. What was collected was a little different for the youth programs versus the adult programs. So we did look at them separately. But some of the metrics we were focusing on included credential attainment, employment placement, employment retention, earnings, and recidivism. And we first compared organizations within their cohorts, so those that were funded by the same grant program in the same year. We identified the highest performing organizations within those groups. And then we compared those high performers across all those cohorts to identify those organizations that really stood out. And then we began to do what's called a document review. And so we didn't want to just look at the data. We also wanted to look at the strategies that were being used. And so with a particular eye to the use of evidence-based practices, we wanted to ground this entire study in the empirical research. And so we read the proposals, we read reports that were sent in, we looked at evaluations of the programs, any information we could gather. And then from that group, about 14 organizations, we selected 5 that we wanted to do an in-depth analysis on. And these 5 organizations, we focused on them not only because at one point in time they had achieved success over the past 10 years, but they had repeatedly shown a track record of success. So these 5 organizations had been funded multiple times by the Department of Labor, and they achieved higher levels of success than their peers in these metrics across those different grants. And so we believe these were not just an organization that performed well once in a period of time, but consistently were performing strongly over the years. And with those 5 organizations, we did extensive interviews with the program staff to learn what they were doing, what might be contributing to their success in these programs. And then we visited 2 programs on site and did focus groups with participants, and you'll meet individuals from those programs. OIC of South Florida and the Dannon Project are both here today, as well as one of our focus group participants, Kenneth, will be joining us and speaking with you as well. So every study has limitations, and this study is certainly no different. The most significant limitation on this study is that we were looking at data that was reported by the grantees to the Department of Labor. And so that means we weren't using administrative data. And we've seen in studies that administrative data can be a more reliable source of information than what's reported from grantees, simply because grantees, organizations, don't always have access to actual records from, the police, for instance. They have to rely on individuals to report to them whether they've been arrested again or incarcerated again, and so on. And so, but that challenge is consistent across the grantees, and so we think that the comparison is still valid. We're still comparing apples to apples across the organizations. The other limitation on this is that it was not a randomized control trial, as Brent said, which is the gold standard for research. And so we can't definitively say that every practice we're identifying absolutely led to the success of these organizations. You would need a much more rigorous and lengthy evaluation to claim that, and that wasn't the scope of this study. And last, I want to emphasize that we focused on current practices when we were doing these interviews. You can imagine if I called you up and asked you what your organization was doing 10 years ago to be successful, you'd have a hard time answering that question, right? And so we really focused on what have you learned over the years? You've shown to be successful, over multiple iterations of these grants. What have you learned? How have you improved? What are you doing now based on that? And we did see actually that the programs that we we studied had pretty remarkable staff retention. So both of the CEOs who are here today have been with the organizations through the life of these grants, and many of their staff members have as well. So we did capture some of that institutional memory, but we did focus on their current practices, what they're doing right now. So I'm going to share with you very briefly a couple of key observations from these interviews and from this study. And then we're really going to get into the meat of our learnings through some panels that we're going to do following this. And so I'll do this very briefly so that we can have time to really talk to the experts who are doing the work on the ground and our friends from Department of Labor and Department of Justice who are here. So one of the first observations that we had were that these high-performing organizations, we were going to great lengths to assess the needs, the strengths, the barriers that individuals faced when they walked in that door, and then they were using that information to individualize services. So they did not take a one-size-fits-all approach in this program. There wasn't necessarily a required path that every single individual had to follow. So some individuals' participation in the program could have lasted 3 months. Some could have lasted several years. The intensity of services was really targeted towards the needs of that individual. So, for instance, if you had an individual who came in who was incarcerated, like some of our participants were in our focus groups at the age of 16 for 28 years. Right? This individual may not have had a high school diploma when they're released. They have no work experience. That's an individual that you're going to have to work with, potentially longer to be able to help them prepare for that GED, increase their basic proficiency skills in reading and math and so on, to be able to work with them to get that job. You might have individuals who were incarcerated as adults who had might even have degrees or have extensive work experience, right? So this is why you need to tailor your services, and that's what we saw with these organizations. The second is we found that even though it wasn't necessarily required in some of these grants, the high-performing organizations worked very closely with prisons to provide pre-release services. So they weren't waiting for individuals to be released or to be put into a work release facility to begin services. They really tried to start offering training and case management services while individuals were still in prison, and typically within 6 months or so of release. And they found that preparation with an individual, planning logistics, where are they going to live, how are they going to get their driver's license, to thinking about building a vocational mindset, what career options might you be interested in, and where are the jobs in this local community, beginning to have those conversations, as well as doing even some peer mentoring and cognitive behavioral therapy based discussions in prison. We saw this was a common set of services among the high-performing organizations. The third was that, over the years, as I think Brent alluded to, the Department of Labor, Employment and Training Administration has really focused these grants more and more on providing industry-recognized credentials. It's not enough, although it is important to just do job readiness. It's also important to make sure these individuals have industry-recognized credentials that will help them be more competitive in the marketplace, and that these credentials are tied to what employers are looking for and where there's actual job growth in that local community. And so with the high-performing organizations, we saw strong use of local labor market information. They were really analyzing, through collaboration with their local workforce development boards or the community colleges, analyzing where the jobs were, where they were projected to grow, talking with employers about the skill sets that were needed and the certifications that would help prepare a person for those high-demand jobs, and then partnering with the right organizations to offer those credentials. And the fourth was a finding that we weren't looking for but really stood out. When we walked into these interviews, we were focused on systems, services, processes. What are you doing? What services are you offering? How does it work? What we heard when we were talking to program participants, when we were talking to staff, was that all of that's good, but it's how you do the work and who does the work that matters. It's the relationships that individual participants develop with program staff that can make the difference between an individual staying with the program and staying through the training and getting that job and staying connected if they face further hardship down the road versus an individual who disengages and doesn't end up benefiting from the program. So the relationships that are developed through this program, peer relationships, but especially relationships with staff, we just heard over and over again was critical. And that's a hard thing to replicate, right? It's a little more difficult to quantify. How do you find the right people to do this work? But we did find that these high-performing organizations had staff members who had incredible heart for this work, incredible passion for it, and it was very apparent that caring, that relationship, that constant presence and reliability made a great difference to the program participants. Okay, so I'm going to now introduce my colleague, Jessie Kendall, who's going to come up and give you a little context on this first question we're going to address with our panel, which is when should reentry begin?